Like most high school kids, I participated in most of the sports, football, basketball, but I'd always been the local YMCA rat as well, where we had a swimming pool. It was just a little 13-yard pool, but we had a swimming team there, and that's the sport that I was always doing the best in, not the one I liked the best, but at any rate, when I was in my final year of high school, I decided that I should give swimming a little better go, and so I didn't play football that year. Played basketball though, and the following year I went to Western, and that's really when I started swimming a lot better because I had more time and more coaching and more concentration on it. And back then, as long as you passed each year, you keep swimming. So I swam for 4 years in physical education and 4 years in medicine. So I had a pretty long go at it. In my third year, I was fortunate enough to make the Pan American Games team. And back then they didn't have so many events. They didn't have a 100 butterfly, which was my event, but I swam the 100 butterfly lap on our relay, which we got a silver medal in, so I got a taste of international competition. Woodstock Collegiate Institute is where I went. And when I was in grade 13, Libby McCaskill was in grade 10. And I knew her. Her father was my dentist and so on. But at any rate, she invited me to the Sadie Hawkins dance. That's the turnabout dance that particular year. And I went and we had some fun. But it was a little off and on for 9 years before we eventually got married. Right after my first year at university, I was a lifeguard at Gibbons Park, and Mrs. Kennedy came down, and she said, we got 5 kids, but the 3 younger ones, we wondered if you could give them private lessons, private swimming lessons. With the Kennedy children, they quickly became very good swimmers and swam for the London Aquatic Club, and along the way, I'd met Dr. Kennedy, and he and I talked about orthopedics, and he encouraged me to go into medical school along with other people. And while I was in medical school, he would invite me to the operating room the odd time, and so I had the orthopedics a little bit ingrained into me, but I still wasn't sure when I graduated. The week after I graduated from medical school, we got married. When we got married, we went to Ann Arbor, where I was an intern and a first-year resident. I applied then for a year of general surgery, which is what you had to do. And so I applied for orthopedics. And I got an acceptance into orthopedics at Michigan. And I was quite thrilled about that, so I came back to tell Dr. Kennedy. Dr. Kennedy said, don't take it. And I said, what do you mean, don't take it? I thought you thought that was a good place to go. And he said, well, we're going to start a program back here, and if you know what's good for you, you'll come back and be the first resident in the program. So I went back to tell Libby, who was teaching at Ann Arbor High at that time, which was a pretty good school. And she wasn't so happy about coming back, but we knew what was good for us, so we came back, and I became the first regular resident in the program. When I started my residency in 1966, Dr. Kennedy started looking after the UWO football team. Dr. Callahan from St. Joseph's, a general surgeon, had done it up to then, but he stopped then. And that was, for the most part, me, because the games were at McGill and Queens back in those days. He would go to the games in Toronto, but I got sent to the others. And through the week stuff, I would meet the people in the emergency room at Victoria Hospital. Back then there was no subspecialization. You were just an orthopedic surgeon and you did what came along. although he was interested in knee problems, and so quite a few athletes would be steered his way. So I finished the residency in 1969, and because I was the first one, he thought I needed a year of finishing school before I was ready for practice. They call that a fellowship now. But he gave me a couple of choices, and I selected Duke. Dr. Goldner, the chief, wasn't happy with the knee fellow there because he couldn't use the arthroscope. He said, I tried it, but I couldn't do it. I got fed up with it. He said, well, get Bob Jackson down and give you another lesson. So Bob came down, and I was there then, so I got introduced to it there. I started practice the next year in mid-1970, and Dr. Kennedy suggested I go down and with Bob and learn a little bit. So in '71, I spent 2 afternoons down there. That was my training. We did 3 cases each time. It was just diagnostic arthroscopy. That's what you did. The Watanabe arthroscope was a bit of an unwieldy thing with an electric light bulb on the end. It was before they used fiber optics. And at any rate, I decided that it was time. So I think it was in early 1972 that we did our first scope in London. And then the word spread. So I was sort of the technician. People were sending me the scopes to or the knees to arthroscope, and I'd send them back and tell them what they had to do. The odd one would say, you go ahead and do it, but a lot of them didn't, so it was taking a lot of my time. But anyway, we got through that, and after 2 or 3 years, fiber optics came out, and we started getting better scopes, and we didn't do too much operating with the Watanabe scope, except the light bulb was a little tenuous where it came out of the sheath, the light carrier. And I had them break off as other people did, so my first arthroscopic surgery was fishing the loose body out using a pituitary rongeur. But as the fiber optics came along, we started doing more and more things. We got little shavers to get stuff out of the way, and one thing led to another. It got bolder and bolder till finally we were doing ligaments and everything else. But so I grew up through a big period of change. And I think Dr. Kennedy was a little bit of ahead of the curve on that, in that he saw saw that it would be useful to have people to be leaders in the different subspecialties, even though you were doing most other things as well. For instance, he sent me just for a year at Duke, but after me, there were people like Rich Hawkins, who he sent to New York for some training with Dr. Neer in shoulder surgery, and people in spine surgery, Stu Bailey in spine surgery, and so on. And that was a little bit ahead of the curve, at least in Canada anyway. In 1974, they built Alumni Hall. And the significance of that is there was a wrestling room called Combatives Room in Thames Hall, wall-to-wall mats where the wrestling team practiced, and where we took wrestling classes and so on. But in Alumni Hall, they had a facility for that, so the wrestling team and everybody moved out of that. Dr. Kennedy quickly talked to the president of the university and the head of student health to see if they could turn that into a clinic to see the athletes, intramural athletes, intercollegiate athletes, and it happened. So they rearranged it a bit, put some examining rooms in, some physiotherapy equipment in, and started having a clinic there Monday, Wednesday, and Friday from 4 to 6. Dr. Kennedy did that, and after about 2 weeks, he said, why don't you take the Fridays? So I became the Friday 4 to 6 person. It was 1975. I was one of the orthopedic surgeons on the medical team for the Pan American Games in Mexico City. And then in '80, I was picked as the orthopedic surgeon for the Canadian team going to the Olympics in Moscow, but we didn't go because the Russians invaded Afghanistan, of all things. And so half the world didn't go to those Olympics, and I never did make it to Russia, and that's one place I'd still like to go.
Back in 1983, when I showed up in London, Ontario, I had a fellowship arranged with Jack Kennedy, who at the time was one of the top sports medicine surgeons in the world. I was very happy to be there, and it went fine for a couple of weeks. And then one day at football, I got a call in the training room. I answered it and was told that he had passed away. So one of my first jobs was to notify Pete and all the staff that Dr. Kennedy had died. But luckily, Pete didn't send me home back to Michigan. He allowed me to stick around and became my mentor, and the Pete Fowler Sports Medicine Fellowship began.
Dr. Harvey Bailey took over as chief, and he felt it would be better if I moved up to the University Hospital, which had been open a few years, and it would be easier for me to do the teams but also start an arthroscopy and sports medicine sort of subspecialty, so that they got some specific training in it, the residents, that is. So that was 1982, and partway through the year, a chap called Eric Lenzner, who had trained in Toronto and was an orthopedic surgeon in Stratford, phoned me up to see if he could come down for a few weeks or months. He wasn't sure, because he wasn't happy with what he was doing. He'd like to do the kind of stuff that I was doing. So he came down, and I think it was for, I don't know, it was 6 months or less. And he actually got the job during that time at McGill to be the head of orthopedic sports medicine there and look after their teams. And so I sort of enjoyed having a fellow besides the residents that would be with me all the time. So, and a lot of my American friends, my associates over there had started fellowships, so I thought, that's a pretty good idea, let's get going on it. So we started having them from starting in August to May, a 9-month fellowship. That's how we started it out. And then it later became a year.
One of Pete's great legacies is the fellowship. He has really trained the leaders of today's orthopedic world throughout the world. There's probably no fellowship that touches the corners of the world the way the Fowler Fellowship has. And Pete has trained this generation of leaders to really behave in the way that he has, and that's promote team first, to be humble, to be honest, to be straightforward with their patients. And hopefully all of us have taken away some of that, because really the fellowship is truly Pete's legacy.
I'll never forget my first day in the operating room with Pete. He gave me the scope, told me to start the case, and after about 2 minutes, took the case away and said, "Take $20 and go to the arcade and learn how to use your hands." I thought it was going to be a long year at that point, but it got a lot better.
We renamed it the J.C. Kennedy Athletic Injuries Clinic in 1983. And I thought it was a bit of a shame to be vacant all day, so in 1984 I was one of the physicians in the Sarajevo Olympics, and Derek Mackesy was one of the primary care physicians who'd always been interested in sport medicine. And I convinced him to come down and work in the clinic and keep it open all day, and then I'd come over 4 to 6, Monday, Wednesday, and Friday. And Brian Gastaldi was our head physiotherapist at those Olympics, and I recruited him, but it got too big, and unwieldy, and so eventually plans started to build a clinic where we are right now. And that we moved in there in 1996. Bob Furlong, who was our manager then, wanted it to be a sort of one-stop shopping thing, and figured that we could have the physio, we could have a bracing operation, we could have a little store for things, we could have orthotics people come in, and everything except the operating rooms. And so that's what happened pretty quickly, and it ran along very smoothly, actually. It just grew and grew. So we quickly, by the time we moved in here, we had 4 orthopedic surgeons, and we've kept it at that. And now we have 4 fellows with them, plus the residents. So it's, the orthopedic part is pretty busy, as is all the rest of it.
When I hear the name Pete Fowler, a smile comes to my face. He's a unique individual, a good friend, and a trusted mentor. When I arrived in London, Ontario with my wife Nancy and our 4 small children, we embarked on an adventure. We called Pete and Libby. They immediately said, "Come on over, we're out back by the pool." So our very first day was spent having a cookout and being amazed by their diving dog and really being impressed by their Canadian hospitality. My experience there was invaluable. He instilled confidence, he challenged me, and to this day I respect his opinion as much or more than anybody else in orthopedic sports medicine.
And then I got involved with the Commonwealth Games Association, and I was their chief medical officer in 1990 in New Zealand, and then 98 again in Kuala Lumpur. And those were fun games as well. I got involved with the International Arthroscopy Association. Bob Jackson sort of took me under his wing and made sure I got involved in these societies early on. And then I got involved with the International Knee Society, and then these 2 societies came together, and 1995 was finalized, and then the first combined meeting with them both as one group was in 1997 in Argentina, and I was the first president, so that was a big thrill. And then being president, I was president of CASM, the Canadian Academy of Sport Medicine, early on in the 80s. And then in 1993, my meeting was, I was president of the 2003, I was president of the American Orthopedic Society for Sports Medicine. And those were good jobs and decent experiences as well, and I really enjoyed them, and so those were some of the big things.
Over the years, Pete has been a huge mentor to me, along with Hawk, and on a regular basis in clinic or in the OR, I still use his approach to this day. His honesty, his forthcoming with patients, and his ability to connect with patients and students and colleagues around him, somewhat unconventionally at times, but always direct and sincere and believable, anything that he would say.
I've tried to teach them it's the general principles of practicing medicine. Listening to the patient. I get very annoyed at people that come to a conclusion quickly before they've listened, ask the right questions and listen to the answers that the patients give you, because they usually end up telling you what's the matter with them. And you have to do the physical exam, but most of the time you should know before you do the physical exam. Then, of course, doing a proper physical exam and trying to keep your civility when you're talking to the patients. And they're not all Rhodes Scholars. And and just be nice. And I think that's the main thing. The surgical skills, I mean, most the surgical skills they will learn. They all learn, but the big thing is trying to teach them when to operate and when not to operate, and that's by listening to the patient, I think.
This is a sincere thank you for allowing me the privilege of studying under you back in 1991 at Western. I'd also like to really thank you for allowing me and Wendy into your family, for Liv, for Megan, and for little Pete. I'd like to take this time to send a shout out to Ned Amendola, to Tony Miniacci, to Anna Hales, to Betty Rutledge, and to Larry Watson that I did my fellowship with. They say that in karate and in martial arts, the most important thing is stance, and that's having a balanced core. And what I learned from you was to establish my own orthopedic balanced core and stance.
It's not me or it's not us, it's the fellows. We've had a pretty good selection. Been able to select good fellows through the years and from all over the world. I think that's the big thing. We're not just training Canadians and Americans, although that's the way it started, but we have many that come from Australia and New Zealand and Europe now, England, but the rest of Europe as well. We've had 2 or 3 from Holland. We've had them from all over the damn place, and I think that's a pretty good indication that we're doing something right anyway.
My favorite Fowlerism comes to mind at the time we were driving to Devil's Glen in a snowstorm, and I would remember you saying, when the driving is great, the skiing sucks, and if the driving sucks, the skiing is great. And I think that's a good corollary to life. If the training is hard and rigorous, then great patient care and a well-trained surgeon are the result. Mahalo, Pete.
Just seeing how some of the fellows really developed in their year here and what they have done subsequently, and many of them have become leaders in the field in their respective countries and communities or whatever, and I think that's the biggest thrill.